Every day, doctors, nurses, and other health professionals are presented with situations that demand empathy and compassion. Whether telling a 40-year-old man with cancer he doesn't have long to live, or comforting an elderly woman who is feeling anxious, the health professional needs to be skilled in understanding what the other person is going through, and respond appropriately. With more demand on doctors and nurses and a push for quicker consultations, clinical empathy is being dwarfed by the need for efficiency. But this doesn't mean patients have stopped wanting to be treated in a caring and empathetic manner. And there is a growing body of evidence that this need is often not being met. Empathy is key to good communication. In the novel To Kill a Mockingbird, Atticus Finch tells his daughter Scout that, "You never really understand a person until you consider things from his point of view, until you climb into his skin and walk around in it." This is empathy, where one identifies with another's feelings. It involves compassion and the ability to understand and respond to the feelings of others. Often, an empathetic response leads to a caring response. Empathy is different to sympathy, which is described as feeling sorry for another person. This does not require us to understand the other person's point of view, but is an automatic, emotional response. In healthcare, feeling sympathy for another person can overwhelm us with sorrow and often preclude us from helping. In recent times, poor communication, including lack of empathetic and caring behaviors, has resulted in an increasing number of complaints against health professionals in Australia. Shocking cases of maltreatment at a United Kingdom public hospital between 2005 and 2009 reveal the extreme consequences of negligence, poor communication, and lack of empathy in healthcare. Incidents ranged from patients being forced to drink from flower vases to lying in their own excrement. More than 300 deaths were directly linked to this neglect. At the crux of the recommendations made in a report of the inquiry into the incidents was the need for improved communication between healthcare workers and patients. Empathy is fundamental to effective communication. For doctors and nurses, this means placing the patient at the center of care. This skill leads to increased levels of satisfaction not only in patients but also the doctors and nurses. Importantly, it is also associated with improved patient outcomes.